There's a feeling something big is going to happen to Cuba. It's a country in the midst of an energy crisis, under pressure from the United States, and its government perhaps struggling even to survive. For a week we filmed undercover in cities across Cuba, documenting a collapsing health service. Well, I'm back in Cuba, and I have to say conditions here are worse than they were the last time I was here in March. The government blames the problem, particularly with power, on the American oil embargo. This is turning into a crisis for the country, no doubt about it. We're looking specifically at what's happening to the health service here, and particularly looking at hospitals and how they can cope. The oil crisis here in Cuba is well documented. What people sometimes don't know is that Cuba does have oil. It just can't provide enough of it for its domestic needs. So the country is dependent on foreign oil imports, and those foreign imports and years of economic mismanagement have made it almost uniquely vulnerable to oil price changes and supply disruption. President Trump's oil embargo has compounded the problem and is strangling Cuba. Along the coast, the refineries tick over, but there's no fuel coming in. Oil and fertilizer tankers are stationary in the ports. The US blockade has rendered these facilities all but redundant. The government doesn't like the world seeing the country like this, but what's more hidden is what's happening to Cuba's once iconic health service. To see it for ourselves, we had to avoid detection and surveillance to get inside, to witness its collapse. In parts, it's truly shocking. This is a cancer hospital in the city of Santa Clara. At first sight, it's hard to believe that it is still functioning. There's a sense that it's basically abandoned. Waiting rooms are shut down. There are locks on doors. Its pharmacy is closed. The whole clinic is in general disrepair. The store of oxygen is crumbling and neglected. There's just a few rusting canisters to be seen through a locked gate. In the wards, cancer patients must wait for treatment. It is most likely never coming. There is little sign of real sophisticated treatment. There doesn't appear to be any medicine. There is little power. It seems hopeless. A few hours away is the city of Matanzas. It's near the government-run tourist resorts in the town of Varadero. It means they've got more power than other parts of the country, but the hospitals are still in need. We've come to see the Faustino Perez General Hospital. It's a huge hospital once capable of treating 700 inpatients. It's still functioning and in better shape than other hospitals we've seen, but it's struggling. I met Dr. Laudelino Fernandez, the head of the emergency department. For 3 decades, he has run this section of the hospital, and I got the sense his sheer dedication is why the staff are so committed to keeping it going, despite the chronic shortages of everything. Dr. Fernandez doesn't blame the government for the crisis. Quite the opposite. He blames decades of sanctions and President Trump's blockade.
What the doctors are saying is that even if they have a lack of drugs, they still let people come in because they're determined to treatment, even if they know they're fighting perhaps even a losing battle, but they feel determined to keep providing health care for everyone who goes.
There are vast corridors and staff wandering about, but it doesn't feel that much is really going on. The main problem the staff have is the basic lack of supplies. The dream of the revolutionary leaders, in particular Fidel Castro and Che Guevara, was to make an outstanding health service available to everyone. And they did. Vast hospitals such as this one were once like nothing the rest of the Caribbean islands had ever seen. It led the way and was in many other ways a world leader in medical expertise. But that investment has dwindled, leaving them with very little.
This is the intensive care unit, where you would expect to have an awful lot of drugs, but as you can see, a lot of these are empty. This is your fluids, yeah? That's all of it. Also, for a hospital that had over 300 patients, have got that much water, but sterile water. And syringes.
Insumos.
That's it. And that's basically bare. Yeah. And that's the supplies for the whole of the emergency section.
Clearly, the current oil embargo, the government's own lack of investment and mismanagement, and years of US sanctions have finally combined to crush the health service's ability to properly care for its population. All they have now is the perseverance and dedication of the medical staff, doctors and nurses who remain world-renowned for their medical ability.
If the oil embargo continues, the levels of medicine becomes more difficult. When we go into a season of high diseases like malaria or chikungunya or even COVID, are you worried that it's going to be very difficult this year to treat people?
Nosotros por el embargo no nos podemos parar, porque tenemos, a ver, el médico, el servicio, lo de nosotros es servir, y servir a una población. Como servimos a una población, tenemos que estar, es decir, en la obligación de buscar soluciones. Ahora, no obstante a eso, el bloqueo sí nos lleva contra la pared. ¿Ok? ¿Me entienden? No obstante a eso, ustedes están viendo un hospital trabajando en su totalidad. Es decir, un hospital grande, trabajando, operando, a veces con más, con menos, pero tratamos de ir adelante buscándole soluciones desde lo interno. Desde lo interno y a través de amigos y a través de eso. Pero realmente el embargo nos lleva a, es decir, las medidas del embargo son las que nos llevan a nosotros contra la pared.
The rainy season is coming now, and the early storms are really quite something. The thunderclouds rumble, and only the very brave or young risk the lightning crackling through the skies. Every year from June to November, the health risks from flooding and the subsequent pools of stagnant water guarantee a spike in mosquito-borne illnesses. The health service always struggles during these months, but this year the warning is that the disease rates could be worse than ever if people can't be effectively treated. The old and the very young are always the most vulnerable. Families visiting the Mariana Griales Maternity Hospital in the city of Santa Clara know that the next generation is dependent on them for survival over the first few days and weeks of their lives. They arrive bringing food and essential supplies for the expectant mothers and their soon-to-be-born babies. The hospitals simply don't have the resources to provide anything but their medical knowledge. You continuously get the sense that the staff can tell their patients what's wrong, but can't do much to treat it. Entry into this maternity hospital is extremely restricted, so our filming has to be very discreet. What we found is a working but increasingly neglected and dilapidated facility. In a crowded ward, pregnant women lie on beds, grateful for the meagre coolness of small fans. There's no aircon here. Like so many of the hospitals we visited, just getting by is the best anyone can hope for in Cuba today. Across Cuba, there is a sense of a resigned acceptance by everyone that every basic function of state is slowly grinding to a halt. The streets are usually very quiet and there are few cars on the roads. One way of getting around Santa Clara is on an electric tuk-tuk taxi. In evening sunlight, the torrential rains of the earlier storm have subsided. The destination, the Arnaldo Milan Castro General Hospital, another major facility struggling to function. The cover of darkness assists our arrival. At the accident and emergency entrance, an ambulance delivers a new patient to the cavernous interior of the building, while another receives a patient to transport elsewhere. What is really striking is how the hospital has to prioritize power for certain sections and certain wards. Much of the hospital is in total darkness. Along one corridor alongside the critical care unit, a man wheels a hospital gurney towards a ward. It's piled high with food and supplies. His elderly relative follows behind in a wheelchair. In every ward, families keep their loved ones company. It seems that there's always a member of the family on duty into the night, making sure the patient has what they need. The medical staff will help for sure in an emergency, but the families are there to make sure the patient is comfortable. And it's not pleasant inside. Gloomy toilets are filthy. There's a feeling that nothing much works. Staff listlessly wheeling equipment to where it might be needed next, if indeed it's still working. Revealing the truth of the health service all but broken would guarantee some form of punishment from the authorities. But one hospital worker we filmed anonymously said the health system had stopped working, so they're now dependent on the black market for all supplies.
En la calle sí hay todo eso. Entonces las personas lo compran y se lo traen a familiar. Por otro lado, los mismos médicos te lo piden. No tienes que buscarle esto, buscar aquello para tú operar a una persona, porque no tienen los instrumentos tampoco, no los tienen. Ellos están a veces en la mejor disposición, pero es que no los hay. Ellos quieren ayudarte, pero no los hay. Y al no haberlos, ¿qué van a hacer? Entonces tiene que ir uno para la calle a comprarlo todo, desde el hilo de coser hasta la anestesia, los guantes, todo eso hay que comprarlo en la calle. El hospital no los tiene.
In the hospital grounds, past the morgue, we find piles of discarded rubbish. Alongside it, more piles of spent supplies and equipment. Basic health management and cleanliness rules seem to have stopped or been abandoned at this hospital in the face of crippling state failure and sanctions. In the gloom, we see a man sleeping rough outside. Next to him, hanging on a fence, his freshly washed white shirts. He's a hospital worker, we're told, who can't afford to travel to and from home. So he sleeps here until his next shift begins. It's a metaphor, perhaps, for a broken system, and a staff who won't give up, perhaps don't even know the system is over. While Cuba may be an economic freefall, run by an elite out of touch with the ordinary people, while being pressured by an anti-communist government in neighboring America, it remains an extraordinarily beautiful place. Importantly, the Cuban government realized early on that developing tourism would provide it with billions of dollars of foreign currency. Specific coastal areas like this one in Varadero were earmarked for development. And basically, purpose-built towns began to pop up. Walking through them, all the infrastructure is in place. The cafes, bars and restaurants are all there. The staff are there. It's the lack of people that's the problem. Well, under President Obama, the sanctions against Cuba were relaxed, and the government then set out on a huge tourism drive, building dozens of enormous hotels and beach resorts. And of course, the whole point of that was to try and get hard cash into the country. Now, it was successful at the beginning, but then President Trump came to power. Since then, the tourists have dwindled. And a lot of these almost monolithic holiday structures are still in place with nobody in them. For the tourists still visiting plush resorts like this one, there is all the entertainment one could ever need. There's a veneer of normality to all of this. These hotels have 24-hour food, power and air conditioning. But the empty sun lounges say all that one needs to know about how successful this policy has turned out to be. While the lights burn brightly into the night for one of the endless parties, it's not lost on the Cuban people who face 22 to 23-hour power cuts every day across the country that this is economic madness, both unfair and unsustainable. It does feel like something big is about to happen here, but every Cuban asks what it will be. Can the government resist the will of the United States? It's difficult to know. But if every sector, even the much-cherished health service, has collapsed, it's hard to believe the inhabitants of these cities, towns and villages can just limp on into ever greater poverty.